Assume you have a grumpy patient. It could be a patient, a relative, or a parent. When they're unhappy, they're urged to come speak to a member of staff. They can come to you or the consultant because you work there. They usually ask to talk with the consultant. If the consultant is not available, they may wish to talk to the senior registrar or Saint 5. The patient may not escalate the matter or submit a formal complaint if they are happy with your response and explanation. So respect that person, accept that they have the right to complain, and listen to them. Respect their feelings, acknowledge their anger, explain and try to answer their questions, and keep them informed and involved in the actions taken. Then you'll offer them feedback on the action taken if it's an incident reporting triggering occurrence.
What if they keep complaining about the staff? They have two options. They can either go to PALS or the CCCG, Clinical Commissioning Group. This system is unique to each NHS trust or hospital. Internally, this system handles patient concerns on a local level, trying to address difficulties amicably. If a patient or person goes there within 3 days of filing a complaint, they will usually have a phone or spoken discussion about it. Within 30 days, they will receive a written response from the chief that will include various elements, including an apology if appropriate and needed. Number 2. A thorough answer, a good detailed response to every area of the complaint, any actions made to prevent recurrence. If they are not satisfied with how the case was handled locally and also with the trust's final decision on how to handle their problem, it will be referred to the Ombudsman. The Ombudsman is a separate NHS service. It's not part of the NHS. The Ombudsman usually resolves unresolved NHS complaints. They are known by several titles around the UK. They propose a formal solution to the issue. The same is true for the GP or dental clinic, but it's usually easier to go to the PALS because it's right. It's just getting out of the hospital and going to the PALS there, and it's useful and recommended if the patient wants. Let's say a patient is still in the hospital and they're dissatisfied with the care they're getting. Also, be aware that those who file complaints have access to organizations that will help, support, and guide them through the process. Local Health Watch and the NHS Complaints Advocacy Service are two of these organizations. Patients are frequently provided informational booklets regarding the complaint process and can contact these organizations for assistance.